Hello, welcome to the What If It's Not Depression podcast. I am interviewing Dr. Juliana Nahas. She's a board certified pediatrician and a functional medicine certified practitioner who specializes in treating complex pediatric health conditions like autism, ADHD, autoimmune disorders, abdominal pain disorders, obesity, asthma, allergies, eczema, and more. So for 25 years, over 25 years, Dr. Nahas has served her community in the tri-counties of Newton, Rockdale, and Walton, Georgia. And she will be offering some virtual visits soon in the local Georgia and neighboring
Florida.
state.
Yeah,
What was that?
Florida.
Florida, that's right. I know you told me, but I forgot. So Dr. Nahas is an integrative physician experienced in both conventional and holistic functional approaches, as well as in mind, body, spirit medicine to help your children have the best overall health possible. I've been wanting to get a pediatrician on my Vodcast for a while because I do see quite a few children in my practice, and so many people want to find functional medicine practitioners that see children specifically and adolescents. So after experiencing her own troubles with an autoimmune condition that almost rendered her crippled, Dr. Nahas searched all types of conventional and alternative modalities to get well again. She knew that taking Advil every day wasn't the answer. And she found that energy healing, yoga, and mindset meditation, as well as functional medicine approach, led her to resume her vibrant energy and vitality in a short few months. So now she combines her knowledge and expertise with her pediatric and adolescent clients to customize their treatment approach and help them restore their optimal health. Welcome, Dr. Nahas. It's such a pleasure having you here.
Thank you, Achina. Thank you, Dr. Stein.
So I would love it if you can start with your own journey. It's really helpful. And I find that, lots of functional medicine practitioners find functional medicine because they themselves get sick or have issues, and they are unable to find people or providers to help them get well. And so they have to do it themselves, right?
Yep, that's right.
Yeah,
that's pretty much, you summarized my story. So I was around 42. It was a couple of years after my second child was born. And they say that pregnancy sometimes triggers autoimmune situations in the body. So I was about 42 and I just developed daily migraines, aches and pains all over my neck, my back, even my small joints like my hands. And it became difficult to write. I would reach for a prescription pad and I couldn't even finish writing the prescription because I was in so much pain. And there were days I would wake up and it's like, I don't know how I'm going to get out of bed. I would have to take a warm shower and kind of thaw out my joints so I could move and get dressed and go to work. So after going to see a chiropractor and seeing an orthopedic surgeon, and everybody told me, yes, your x-rays show osteoarthritis. I was like, but that's an old age disease, isn't it? Like, correct me if I'm wrong. I don't deal with adults. And they're like, yeah, it is. But they were like, so matter of fact, like, it's okay that you have it. But it wasn't okay with me. So, other than adjusting me or taking over-the-counter painkillers, they really didn't have a solution.
Right.
So I had to go online and listen to people like J.J. Virgin and other luminaries in the functional medicine arena. And at the time, there was a lot of telesummits on health. So there was the gluten summit and the food summit and this and that, right? So after listening to a few luminaries, I'm like, I'm going to do this. And I bought J.J. Virgin's book and her program. I think she was selling it on PBS at the time. And I did it.
How many years ago was it?
Oh, gosh, that's back in like 2012, 2013. So a few years back, right? Almost a decade.
Right.
And I did the program that she outlined, and I did feel better, significantly better, but it wasn't completely gone. So there was something I was missing. But then I didn't know what else to look for. So I just went on with my life and my symptoms got worse again. And I figured, okay, I can't nickel and dime this. I can't be my own doctor. I really need help. So I signed up with a doctor and a nutritionist team that were in my state. And at the time, they were offering a group program. So it was fun because we had the accountability and other women, that were my age, to bounce off of and to go through the journey together. I think going it alone is a little hard with functional stuff.
I
And within,
I completely agree with that.
yeah,
Totally agree with that. In fact,
it's,
I just finished an online boot camp, and it was extremely successful, a lot more successful doing it as a group than one-on-ones. I was
yeah,
so blown away by that. So I
yeah.
concur. I'm glad you had that experience and you're able to talk about that.
Definitely. It really started me on my journey. I mean, within 3 months, it was a 4-month program, 16-week program, but within 12 weeks, I was completely healed.
Mm.
And I say healed very strongly, even though you can say, well, you can't reverse autoimmune disorders, but I felt so much better. I shed like 15 pounds. My skin was glowing, no aches and pains anymore, no migraines anymore. And it really felt like I'm back, I'm back to my 20-year-old self. I was 40 at the time, but I didn't feel old anymore. So that
Right.
was amazing. Yeah.
That's
Um,
great.
and then around that time, patients started noticing, like, you look different. What are you doing? They started asking me. And also parents wanted holistic approaches to their children with ADHD and other mental health disorders. So I started putting two and two together and felt like, okay, I'm going to go study this because I don't know enough to now treat people, but I know enough what I did on myself. So I went ahead and studied with people like Dan Kalish, Chris Kresser, IFM, and a little bit with Dr. James Greenblatt here recently and Dr. Kurt Waller to get just some extra pieces I needed. And with all that training, I feel like I can really now dial it in for the children and really understand what they need because it's a little different than what adults need.
Mm-hmm. Absolutely. Yeah. What I found is, and I see a number of children that have speckles of different disorders, so to speak, right? They have sort of on the spectrum kind of symptoms, but they also have behavioral issues and they also have ADD, attention issues, temper tantrums. It's a depression, anxiety. It's a combination of a whole spectrum, but not
Yeah.
necessarily in one specific disorder in the DSM. And what I find is that so many practitioners conventional practitioners, I should say, spend so much time trying to nail down a diagnosis as opposed to saying, why is this happening right now to this child? And so much time and money is spent figuring out what the disorder is so that they can match a pill to the ill. The problem is that these medications are not appropriate for especially the very young children. As I was telling you before we even started, that I saw a 7-year-old who started having depression and suicidal ideations at the age of 4. And putting her on an antidepressant actually made her significantly worse. And so the mom, is looking for other alternatives. So
Yes.
do you experience the same thing?
I see a lot of teenagers with depression, anxiety, OCD, those types of things. A few younger kids than 10, but not a lot, thankfully. And really, if you think of their cognitive development, they shouldn't be able to understand what suicide and death is at age 4. That
Mhm.
boggles my mind that that child is even talking that way.
Right. Yeah. Being a psychiatrist, I see a lot more of those.
See a lot more. Yeah.
Yeah.
So
As a pediatrician, you're not likely to see
mm-mm.
those kids because they come right.
Severe cases.
Yeah, they come right to the psychiatrist at that point, right?
Well, it's urgent, right? It's urgent. Those kids are definitely in trouble and they need help. So I would say to the first question, like, why are we seeing such a smorgasbord of symptoms and yet we can't box it? We can't define it. And it may be many, many things. With COVID, I think we had a lot of environmental issues to deal with because our whole lifestyle was put upside down on its head.
Right.
Kids are not sleeping at night. They're not sleeping during the day and staying up playing games at night. They're not seeing their friends. They miss that contact and that daily going to the school, getting out of the house experience. So those are also compounding to whatever biological underpinnings are going
Absolutely.
on.
That's a layer.
And it's a layer, right? So we have to peel all these layers, because ultimately, if a doctor can understand the physiology of what's going on, and I know these are big words for parents, but it's not just about coming up with a diagnosis and a label, because a lot of psychiatric disorders are descriptive. They're not really based on a test, right? Like, we're describing someone with depression or bipolar or
Right.
ADHD. We're not really doing a test to say this is what it is,
Right.
unlike diabetes, for example. So with it being a grab bag diagnosis, it's a little bit more airy-fairy, and there's a lot of nuances we have to distinguish and rule out things that could be going on that mimic stuff like that. Like for my ADHD kids, for example, I need to rule out, do they have a sleeping disorder, like sleep apnea or something, or a seizure disorder that could mimic the symptoms of ADHD during the day.
Yeah, and absolutely. I mean, that's actually the standard of care to rule out any medical causes. And technically, you shouldn't even be given a DSM diagnosis without the medical causes being ruled out. And so, so it's great that you do that, that you're actually searching for those things, because there's so many doctors who don't do that. To really drill down in looking for those medical causes and ruling those out. So that is certainly something that should be done, because the DSM does not talk anything about the causes of why these are. So it's our job to figure out those causes.
Yeah, right. So it's a partnership with the parents, with the teachers. We need to get a lot of information around the child's life and what they're doing. But let's say we did truly have a young child, let's say under 12, who is depressed or anxious. We do see those kids sometimes. What do we do about it? Do we just put them on Prozac? No, that's not the best thing for them. And like your 7-year-old, it could make them worse, right? It could trigger suicidal ideation and attempts, but it could also make them worse physically because of how it's interacting in the brain. Right. So the best thing is to try to understand what could be off balance in their physiology. So maybe they're missing some nutrients. Maybe they have some toxins that they're dealing with. It could be anything from bacteria that are in the gut to Lyme's disease to mold in their system. Even candida or yeast could be influencing their brain chemistry. So we want to look for those kind of stealth infections. I'm big on testing for heavy metals and also mineral deficiencies like magnesium or lithium, because that affects the behavior as well. Absolutely. I've seen kids, with methylation disorders, and they have issues with B6 and folate and B12. So we want to unravel that and understand that. So, somebody with a genetic predisposition to a methylation disorder, for example, would not do well with Prozac. Now, those are the kids that are going to have bad reactions to the medicines, because we're not really addressing the key point. Right. So yeah, this is kind of what I would do if a child came to me. I would look at their diet and suggest some diet modifications. Sometimes it's a food sensitivity. We can test for that, or we could just do an elimination diet. And I give the parents the option because there's a little bit of a cost to do the test. So we could try an elimination diet, see how much improvement we get in 6 weeks. If they don't want to do that, we can go test and really know what are they sensitive to, and then pick out those foods and get them out of the diet. But in children like with autism, they may need a very strict diet. So they might need to be on the specific carbohydrate diet, or a GAPS diet, or a fail-safe diet, or low oxalate or low amines. So there's so many possibilities that it gets a little squirrely in my brain, and I have to then use a nutritionist to help us sort out what do we put them on. And so for those kids, I would say we get down the steps to those more complex diets further down the road, but everybody can start at least with an elimination diet. Okay. The next thing would be to give them enough supplements and nutrients to beef up where we know they're deficient. So the magnesium, the B6, the calcium, the vitamin D, these are key vitamins and nutrients.
And zinc.
and zinc. Yeah, I mean, there's a lot, right? So we
Yeah.
do a multivitamin that has all these key micronutrients in enough dose that their body will now assimilate and absorb it and use it. And in my autistic children, I also throw in the cod liver oil because it gives them the omega, the vitamin A, the vitamin D, and it really helps with eye tracking. I find that those kids that have a lot of stimming, it really helps with eye tracking and eye contact.
Right. Right.
So yeah, so those are some examples of what we do in my clinic. I'm not advanced enough to do IV therapy yet, but we can do glutathione and things like that orally. And if we're following the stealth infections, each one has a different protocol. So I'm not going to go into that, but there are protocols that we follow for the different infections.
Right. So what kind of testing do you like to do typically with some of your younger patients, besides possibly food sensitivity testing?
Yeah. So, for example, in my practice, I accept insurance. So a lot of the parents don't want to spend a lot of money out of pocket on testing if they can help it. We try to test through Quest and LabCorp, but most of the nuanced functional tests are probably best directed through Great Plains laboratories. And they have different panels and they have individual tests. So I'll definitely do the organics acid test as my first. I like to check their stools because I can unravel a lot of what's going on in the gut there. And a hair mineral test is another common one I get. And the food sensitivity that's a finger test or a blood test.
Right. Yeah.
Yeah, those are my go-tos.
Okay, great, great. So and I'm assuming you provide supplements, in terms of, like you mentioned, the vitamins. How do you get the younger ones to take vitamins? What do you do?
So if we can find gummies, we'll do the gummies. If not, we can try for powder and dissolve it in juice or milk or something like that. And if that doesn't work, then we get the capsule, but then we open the capsule and mix it in a food or mix it in a milk or something of that nature. And when I say milk, it's a nut milk or alternative milk, not really dairy, because I pretty much like for all of my patients to be gluten-free, dairy-free.
Right. Yes. I typically put my kid patients, on a gluten-free, dairy-free diet right off the bat. And it's really important to do that. And I pretty much do everything that you do as well. Yeah. I think the challenges become, getting children to become gluten and dairy-free and also, or the alternative is to add foods like all the vegetables, having 5 to 7 rainbow variety of vegetables. So that's the big trick. Do you have any tricks up your sleeve in doing that?
So it's not anything special. It's just making smoothies if we can. If they'll eat it, combined with a fruit, making popsicles out of the smoothies, making it fun in some ways. I can teach parents how to hide ingredients in food. Like if you're making, gluten-free mac and cheese and gluten dairy-free mac and cheese, you can actually cook in some cauliflower and mix that into the sauce. Or if you're making brownies, you can add in beets. Again, you mix that into the sauce, the chocolate. So there's ways of disguising the food and hiding it in, but the smoothies are probably the easiest go-to, unless they can hide it in a tomato sauce based dish like spaghetti or chili. And again, it all has to be gluten-free, dairy-free. So we're using substitute ingredients to make that dish for the child.
Right. Yeah. There's a great company called New Beginnings, supplement company that I use. I use them too. To provide supplements made specifically for children who have autism or or mental health issues.
ADHD too. Yeah.
Yep.
A lot. And they even have a handout for the parents if you ever want to give something to the parents. It has a handout on how to teach your kid to swallow pills. So I found their handouts very useful, very helpful as well.
Yes, I use the same thing. So it seems like we're practicing in the same way. That's really good to hear. That's good to hear. Yeah.
And even though we had to piece our findings and our information from different mentors and different teachers, I think there's still a standard that is shared by a lot of the functional integrative doctors out there. So that's kind of key.
Yeah, that's really good to hear. Yeah, yeah. So we talked about diet. We talked about supplements. What infections do you see typically in young children that you see, over and over again causing mental health issues?
Definitely yeast.
Mm-hmm.
That's a big one. And it can be very sneaky. So again, the patient may have no idea, no clue that they have a systemic yeast infection, or even if it's just in the gut, the yeast can make toxins that then impact the brain. So they're not aware that they have an issue with a yeast infection,
Mm-hmm.
and it could be very stealth-like. So that's where the testing is important.
Right.
So that's the biggest one I find. But the other big one is Clostridia species.
Mm-hmm.
And specifically, Great Plains has markers to detect these toxic chemicals that the Clostridia make. It's not available on Genova. So only
Yeah.
Great Plains can give me these markers. So that's why I do it with the kids, because I really want to find out if they have those markers, then we need to treat the Clostridia. And I do a combo of probiotics and antibiotics in that case.
Right. Yeah. Depending on how bad it is. Yeah.
Mhm.
Yeah. Actually, Great Plains Lab is the only company that does those markers. They have a patent on those
Yeah.
markers, and it is an excellent test. And
Yeah.
it's what makes that test the gem of I think their company. Really,
Yeah.
it's probably the most commonly
Right.
used test with functional medicine doctors. So yes, and the thing I think people need to know is that Clostridia can actually cause mental health issues all by itself, because it blocks certain certain metabolites that they produce, blocks dopamine beta hydroxylase, which
Yeah.
prevents the breakdown of dopamine, and so can cause quite a few symptoms. So picking that up is really, really important. And most people consider C. diff to be associated with diarrhea, frank diarrhea, but you don't have to have diarrhea. In fact, you can be constipated.
Constipated. Yeah. They're most often, if a child comes in and they're constipated, my index of suspicion goes up for Clostridia. And also, like, the manifestation of the toxin is typically aggression, self-mutilation. They tend to be more feisty kids and harder to kind of calm down and console.
Right.
So those are things that clinically I've started to associate with Clostridia.
Right. Yeah. And the child that I mentioned, that was 7 with depression and suicidal ideations, she also had severe anxiety as well. It's more separation anxiety, but at 7 shouldn't be having separation anxiety, but looked like separation anxiety that just didn't remit. And her candida, so I have the parents do a candida questionnaire. Her candida score was 200, which is extremely high.
Wow.
Yeah. Yeah. So it's a really helpful questionnaire to do. And that's something that anybody can find on the internet. The candida questionnaire, it's really helpful. And she had a long history of antibiotics. So we've talked a little bit about candida, but the way to get candida, people get candida, is an overgrowth of it that's part of your normal flora. And it's from taking multiple rounds. Usually it's from taking multiple rounds of antibiotics. But you can be set up for that just from not being delivered vaginally, a C-section, right?
Not being breastfed.
Right.
It's another one. And then, a lot of courses of antibiotics in the first year or 2 of life.
Exactly.
Can
Yeah.
also cause damage. So, but it's a catch-22. Like, as a medical doctor who still does general peds, if I have a child with strep, I'm still going to give them an antibiotic. The saving grace is I tell them, okay, you're going to take probiotics for a month after that. So don't just take the antibiotic. You need the probiotic too.
Absolutely. Absolutely. Yeah. Great. Yeah. So how do you handle stress with children? What do you do for stress management when you come to the population?
During the time I was searching for my own, health remission, I discovered a lot of techniques. one of my favorite ones is EFT, so emotional freedom technique. So it's easy to teach. So
Yeah.
I definitely teach them how to do that for if they have a phobia, if they have like one major thing that they feel they can tap on and resolve. Because when it's vague, it's a little harder to put the words to it. But if they have something specific, then we can work with EFT. I've also discovered these beautiful mindfulness meditation cards for teenagers on Amazon. So I've been buying the decks, and I'll give a card or two to my teenagers and say, meditate on that every day. Like, think it's just ground yourself. Whenever you feel you're going up in the air, get back into your body. Let's do some mindfulness breathing techniques. So I teach them the box breathing technique, which is, count to 5, breathe in, hold for 5, breathe out, exhale for 5, and start over. And that's very calming. Yeah, that box breathing. So, but count to 5 on each side of the box, basically.
Right.
Those are some things I've used. I haven't really taught them how to meditate per se, although I know how to do it, because I feel like you need a course for that. It's hard to do in the clinic. But quick things that I can teach them right there and then. I've used EFT, the meditation cards, and the breathing.
Right. Do you refer them to a specific course that you like, that some of your teenagers like? Or
I do. There's a lot of free courses on EFT, so I'll send them to those. YouTube has a wealth of videos, that just pick a topic and go watch something on YouTube. And we use our local mental health counselors as well for extra help and support, especially the teenagers who are really having difficulty coping or feeling like they're misunderstood at home. Just giving them an outlet where they can talk and vent is useful, very useful.
Great. Yeah. So I think we covered the gamut of what we address in functional medicine: foods, infections, toxins, and stress.
We talked briefly about the toxins.
Sure.
We can go into it more. So yeah, I like glutathione, even if it's just oral, because it's the master antioxidant in the body. Of course, you can take vitamin C and vitamin E and all the other beautiful vitamins, but the glutathione per se is our master antioxidant. So that one I load up on my kids who know are stressed, who know are dealing with a lot of heavy metal or petrochemical toxicities, like, from pesticides and I don't know, oil and fumes from gasoline. And it just helps to boost their mitochondria, which is the motor driver of every cell. And we have a lot of mitochondria in our brain. So it just helps to lift them up and give them an edge on coping with the constant exposure and what they already have in their body. And I also give them a binder. So I like the biocidin family of products, and we'll use the GI detox to help bind a lot of these toxins as well.
Great. And you do testing for these toxins before you start these, or do you?
Yeah, with Great Plains.
Okay.
Yeah. But even if I didn't know, if I suspect that we're going to treat Candida or Clostridia, we still want to bind the dead cells. So I'll use the binder.
Absolutely. Away from other supplements and food.
Away from other supplements.
Yeah. So we practice very similarly. So I'm glad to see that, that we have the same patterns. It's comforting to know, because what we're pioneers in this field, and it is something, you always wonder if this is the right thing to do, because there's really nobody else to at least locally to ask, like, is this the way? But we're fortunate to have a strong community with it between us, where we can actually pose these kinds of questions. But it's comforting to meet people who do things independent of each other. We've never talked about this, and here you are practicing exactly the same way I do. That's really great. Yeah.
It's amazing. Yeah.
Yeah.
It's, like you said, I mean, it's just so good to know that we're not really lone rangers out there, because it can feel like you're alone in the forest chopping down trees. but it's good to know that, you have a community, you have people you can go to. Maybe it's just an email that you can shoot someone, but you can have that dialogue if you're ever stuck.
Right. Yeah, and the great thing is that we see our patients getting better.
Yes,
So people
most
come to us
definitely.
for help because there's nobody else, and here we are getting them better, and that's what keeps me going. I'm sure it
Right.
is for you too.
It is. I mean, I had a 16-year-old come to me who had arthritis. This was several years ago, and she was gaining weight unexplainably. And we did minimal workup because she had very limited funds. And what showed up was that, yes, her thyroid Hashimoto markers were elevated.
Mhm.
So we put her on the elimination diet and just a vitamin, a probiotic, and omega-3. She really didn't have the funds to buy anything else.
Mhm.
And within 6 weeks, she was a new person. She had lost the weight, all her arthritic pains went away. And
Mhm.
her grandmother, who was living with her and had to eat the same food, basically, also had improvement in her arthritis, even though grandma didn't change anything else but the food. So that's the power of how the diet is affecting us. And for me, it was major light bulbs went off when I came off gluten and dairy in my journey, and like I
Right.
got better.
Right.
And here I was eating that food my entire childhood, right, into adulthood. And so, like, what changed? Those were the questions in my mind. Like, what is different about my food now than it was, I don't know, 10 years ago? And it led me on the path of wanting to understand what's happening with our food industry, what's happening in our environment,
Right.
um, and then bring it to the patients that I'm treating. Yeah.
Absolutely, absolutely. Yeah, you said that very well. Yeah, and it's interesting because sometimes patients will come to me and they'll say, "Well, I tried gluten and dairy, coming off gluten and dairy, nothing changed." And I think what people need to understand is that it's just one layer, and
Yeah.
it really is important to go through all the layers,
Yes.
and removing them one at a time, and then you'll eventually see a change, but you have to
Hmm.
sort of keep that layer out,
Mm,
and not put it back in.
exactly. For example, like, for my ADHD and autism patients, I have a 12-week program. I don't sell it online as a group or anything, but I have it in my head. I have the handouts for it, and I take them through that week by week. If we did all 12 steps on day one, like, I don't know, everybody will run the other way because it'll just be too much to take
Right.
in and too much to implement. So we have to do step by step. So the first thing is remove the two biggest allergens in the food industry, which is dairy and wheat. And
Mhm.
then week 2, I'll talk to you about vitamins. Week 3, I'm going to talk to you about testing. Week 4, I'm going to talk to you about other foods that may be involved in this journey.
Right.
But if we throw everything in the kitchen sink at you day one, like, you're not going to do any of it.
Right.
It's
Right.
just too intimidating. So that's why we start with the low hanging fruit, the easiest thing we can find at the grocery store to substitute.
Right.
And then we go further and deeper down the hole because it is a rabbit hole and there's a lot to explore.
Right. Right. Yeah. Yeah. And you have to sort of sometimes put your Sherlock Holmes hat on and figure out, okay, what are we missing? And it really is, sometimes it's going back to the beginning, the drawing board of
Yeah.
the history. And it's like, oh yeah, I forgot that this happened. It's like,
Right.
oh, it opens up a whole new, investigative tool. Like,
Exactly. A
yeah.
whole avenue to go down through
Right,
now. Yeah,
right.
for sure.
So it's
Yeah.
always going back to the blackboard if things aren't, the drawing board, if things aren't getting better, is to figure
And
out, okay, what are we
sometimes
missing?
people, they don't remember everything when we do the full history intake. Like, things
Right,
come to them later on. They might have a conversation with a grandparent and it's like, oh, I learned something new, and bring that information to the doctors. So now we can take that into consideration. So it's always evolving, and it's always a partnership between what we know to do and what the parents bring us,
right.
to consider, and also how they implement what we give them to do, because
Absolutely.
that challenge has to be helped. You mentioned you have coaches. I don't. So, like, I'm trying to be everything to everyone.
Right.
And it's a lot of hats I have to wear, but I'm happy to do it because I love functional medicine. I think it
Mhm.
saved my life. And now I see how I can save the children's lives that I'm dealing with. Yeah.
Absolutely. And through the children, like the teenager that you mentioned, it's also the family
The
around them.
family. Hmm. Yeah.
So everybody gets well
Yeah.
if everyone jumps on board, and it's probably best to do it that way. I always tell my families that, don't just change the diet for the child, because then it makes them like take the sick role in the family. The whole family really will benefit from it. And so I try to get buy-in from the whole family to do the diet. And then the child's more likely to stick to it, right? But
they want to feel part of the family. They don't want to be singled out. I mean, I can't tell you how many times a child will ask me, so what you're saying, does that mean I can't have pizza? And I have to couch my words. It's like, you can't have all kinds of pizzas. You have to have specific kinds of pizzas. So, and we talk about the cauliflower pizza and the plant cheese and all of that.
Right.
Like, they have to make their own, which can be just as delicious. You just can't have that out and about all the time. Like, you have to be specific where you go to eat.
Right. Ultimately, I think the big thing is really talking about the changes that they want to see in order to motivate them to do the work, because it is work and they see it as sacrifice. But I think it's also looking at what can you gain by this, and that it's not forever. It's trying to figure out what's going on with them in the short term so that they can have a longer, healthier, happier life, right? Yeah.
And I think every parent has to weigh that question in their mind. Parents will tell me I'll do anything for my child. But when I ask them to take out 2 ingredients out of their food, they won't do it. So is that doing everything? Really honor your commitment to the health of your child and to the health of your family in general. And know that, yes, it may be a short-term thing or it may be a long-term thing. It depends what we discover on that journey. Not everybody's gluten intolerant. We might find that they do fine, which is fine. You can bring it back into the diet. Right. But there's a period of exploration where we need to do that elimination just to understand how's the body reacting. And with that information, then we can make more permanent decisions.
Right. Yeah. And I just want to let the audience know that, we've thrown out a couple words. There's allergy, sensitivity, and intolerance. So an allergy is an IgE reaction, and a sensitivity, food sensitivity, is an IgG reaction. And an intolerance food intolerance has to do with not having the enzyme, that your body's not making the enzyme to break down that type of food. So lactose needs lactase to break it down. So sometimes people are lactose intolerant. So there's a variety of ways that people can have reactions to foods.
Yeah, for sure. And one thing that I've noticed in children the last couple of years, I don't know if it's because of COVID or what, but they guzzle down their food. They don't take time to chew. And it's so important that they chew and masticate enough to make the food into that pulpy texture, because otherwise it's hard on the stomach to put enough acid to really break down the food fully. Right. And then they have heartburn and they have indigestion and they have bloating and they have constipation. So it starts with masticating and chewing. That's how we get the digestive system moving in the right direction. Absolutely. So I just wanted to remind people of that.
Yes, I talk about that all the time too. It's so great. Yeah. So it was such a pleasure talking to you, Dr. Juliana. It was really great to meet you and talk to you and finally at least address a certain part of our, the health of a certain part of our population, children and adolescents. And right now the light is shining on your head. That looks so beautiful. It's like, oh,
thank you. Yeah, so pretty. Divine light. I love it.
No, you look great. Yeah.
I want that light to shine on every one of our patients. This is my heart, and my entire compassion goes out to these families. I know the suffering they're going through. I want to hold their hand. I want to help them have a better day and get these kids out of this kind of, bubble that they're stuck in and back into fresh air and open space, and have them thrive in their lives again, right? That's why we do what we do.
Absolutely. Yes. While maintaining your own health. So don't get burned out.
Your own health.
Okay. We need you.
Yes, ma'am. For sure.
All right. Well, I thank you again for coming on to my podcast and sharing your experiences and your knowledge, and hopefully we'll, keep getting more people well.
And I was just going to say, if anybody wants to reach out and check my website out, they can.
Yeah.
It's covingtonpediatrics.com. I have a couple of free handouts on the page, and you can also ask for a free consultation if you're interested. But, you know, I'm open. I can't see you physically as a doctor out of state, but if you are in my state, either Florida or Georgia, we probably can do business. Okay.
Yeah. And all of that will be included in the show notes.
Lovely. Thank you so much, Achina.
Okay. Take care.
Bye-bye.
Bye-bye.